Most third-party payers, meaning insurance companies, will not pay for cosmetic procedures. They will only pay if your varicose veins are having symptoms. So what does that mean? If your legs are tired, heavy, achy, if you have cramps, restless legs, those are the types of symptoms that insurance companies will cover. If you've got leg swelling, that's another indication. The third thing I want you to know is that when you come to CVR, it's one-stop shopping. We usually ask you for your initial visit to give us an hour and a half. And the reason for that is you're going to get your ultrasound done that day. I'm going to review the ultrasound result with you, and then I'm going to go over what your treatment options are. And then we're also going to give you a booklet and a pamphlet with information, so then you can decide for yourself what's the best treatment option, to move forward with whatever your goals are. And then we also offer the cosmetic stuff as well, but usually insurance companies don't cover that. But the main difference is we are extraordinarily affordable. We're 50 to 70% cheaper than most of our competitors. And I will tell you the main reason that I do this is because the cosmetic procedures are very gratifying for the patients. The vast majority of them are women. They come in and they tell me that they haven't worn open toe shoes, they don't wear shorts, they don't wear skirts because they're embarrassed about how their veins look. So we provide them a cheap option to get this done. It has an enormous impact on their quality of life as well as their self-esteem. And for me, it's not about making money on the cosmetic procedure. To me, I use it more as a marketing tool because a satisfied patient then refers other patients and friends and family, and it's been enormously successful. In addition, it has the gratifying effects for the patient. So it's one of those win-wins for everybody.